Hey there, thanks for taking the time. Dr. Barry Reed, Mason Spine and Injury Center here in the greater Cincinnati area. Today's topic, low back. The low back, that includes anything from here to about here. And yes, my hands are on my legs or my thighs. But lots of times, when we have an area that doesn't feel right, maybe in here or even in here, or here, and especially all across this area, quite oftentimes, at least in this practice, we find that the culprit or the cause of the stiffness, soreness, pain, tingling, numbness, feeling tired, sometimes the cause is between here and here. So the analogy, one analogy, is for those old enough to know what Legos are. If you've got one Lego and you want to put another Lego on top of it, if you put it close but not quite exactly in the proper alignment and try to stick them together, they're not going to go together. This Lego has to be in alignment with this Lego, like this. That's the same thing with the vertebrae in the spine. The orientation and placement and positioning of the vertebrae is extremely important. When the vertebrae are in proper alignment, the joints work like they're supposed to, and the muscles don't have to work very hard. If you've got one that's here and one of them's over here, then the restriction does many things. It causes more stress in the joint. It makes all the muscles that are surrounding this area work a lot harder, and that area will fatigue more quickly. Not only that, there is a set of nerves or nerve roots that come out from between each of these vertebral levels, all the way from the top of your neck to the low back. So if you've got one over here and it's compressing just a little bit on this side, when you go to bend over sometimes, ooh, we've all experienced that, right? That could be a pulled muscle. It could be a stuck joint. It could be a compressed or pinched or irritated nerve. Could be all three. Could be many other things. Could be a disc problem. Could be an infection. Could be many, many, many things. But when the body sends us a signal of pain or stiffness or soreness or anything other than I feel great, then that's a sign. That's a signal to let us know, hey, something's not quite right. And when something's not quite right, it makes it much more difficult for all of us to do what we want to do. It's almost spring. It's March 15th. And nobody wants to get warm weather worse than all of us here in this area do. Warm weather means being able to get outside again and walk and enjoy and go to the park and go outside for dinner and let the kids get outside and do some gardening and do some lawn work. Well, that's going to be a little more difficult if we've got a hitch in the giddy up back here. And low back pain is no joke. Maybe you don't have it all the time, but it just happens every so often. And we can manage it with medicine or taking it easy or some rest. And that's all fine and good. But it's been my experience that unless it's corrected, then it's just going to keep coming back over and over again. No pun intended, keep coming back. And if and when it does, and if and when someone is ready to see if we might be able to help, please let us know.